Hi, my name is Susan. Like you, I was diagnosed with breast cancer, and my doctor suggested I have genetic testing. I had a lot of questions about it at the time, so I hope I can help answer some of yours. Afterwards, you can meet with a genetic counselor who can give you more information. My doctor told me that some kinds of cancers, like breast and ovarian, can run in the family. Because of my strong family history of cancer, my doctor suggested that I consider genetic testing. Even though I already knew I had cancer, I was told that genetic testing could help me to make a decision about what treatment to have. It could also help me to understand my risk of getting a second cancer later on. And it could help my family members who haven't had cancer understand their risks for getting it. Our genes can have an effect on our breast cancer risk. I met with the genetic counselor and she explained some basic info about how genes work. Our genes are the blueprints for our bodies. They control things like what color hair and eyes we have and what our other features look like. Our genes come in pairs. You get one set from your mother and one set from your father. Sometimes genes don't work the way they should because there's a mistake in them. Genes with mistakes are said to be mutated or altered. Now, everyone has some altered genes, but certain mutations can increase your risk for cancer. The mutations related to breast cancer are usually found in the genes named BRCA1 and BRCA2. Since both men and women have BRCA1 and BRCA2 genes, you can inherit an altered gene from either your mother or your father. A woman with breast cancer who has an altered BRCA gene is more likely to get cancer in her other breast. She's also more likely to get ovarian cancer. You may be thinking, I have so much to worry about with my recent breast cancer diagnosis. Why is this important now? It's important for you now because the results of the genetic testing may affect the decisions you and your doctor make about your treatment. If you know that you have an altered BRCA gene, you might make a different decision about breast surgery. Because of the higher risk for getting a second breast cancer later on, some women with an altered BRCA gene decide to have a preventative surgery to remove both breasts, even if their cancer is small enough to treat with radiation and lumpectomy. This is not required, and many women with mutations have been treated successfully with lumpectomy and radiation. But it can be more difficult for some women to have breast reconstruction after radiation, so it's better to make the decision about preventive mastectomy before radiation begins. Even if you already know what type of surgery you'd like to have, genetic testing may help you and your doctor decide if you have an increased risk for other cancers. Even though this information wasn't directly related to my breast cancer treatment, the genetic counselor explained that there is a risk of ovarian cancer associated with BRCA mutations. She explained ways to reduce that risk after my breast cancer treatment is finished. Something that initially worried me was that someone might use my gene test results against me. I learned that this is actually a form of discrimination. The U.S. has laws saying that no one can use your gene test results against you. For example, your job can't use your gene test results as a reason to fire you, and your results can't be the reason that you don't get a job. Also, insurance companies cannot use your results to deny you coverage or to raise the cost of the insurance you already have. I also wanted to know if my insurance would cover genetic testing and counseling. The genetic counselor told me that they've received payment from many different insurance companies for counseling and gene testing. But you may want to check with your insurance company before having genetic testing to see what they cover. After the counselor answered all of my questions and explained the risks and benefits to me, I decided to have the test. The BRCA genetic test is just a simple blood test. I got a needle in my arm and then my blood sample was sent to the lab and examined. My results were ready within a few weeks. Some people's results have been ready in 7 to 10 days. When mine were ready, I went back to meet with the counselor and a doctor from the Clinical Genetics Service at MSKCC to talk about my results. The main message I want to share with you is that it's important to know your options. Genetic testing can help you to understand your risks and make better informed decisions about your treatment. You can meet with a counselor today, or you can make an appointment for another time.